for me, it was this kind of eureka moment where I was like, oh my goodness, I can't send her home to that environment. I want to write a prescription for a healthy home, and that's not stocked at the pharmacy at my hospital. Teach me where systems can work, and that's what's exciting about today, is hearing how Miami can do that too.
Rocky Mountain Homes Fund is a social benefit fund that was created to provide opportunities for home ownership that are rapidly vanishing in America. And it's made up of Intermountain, Zions Bank, one of the leading regional banks, Miller Family Foundation, which is a wealthy entrepreneurial family, and some other partners that have gotten together and said, we need to positively impact the lives of Utahns. And Intermountain has taken the lead in social determinants of health, of which housing is one. The reality is this: 99% of the counties in the United States are at their least affordable point in their history. We have done then an $18 million follow-on round that assisted 50 families. We're now in the middle of a $300 million fundraise effort for the state of Utah. We have homes all across the state now, and we're now looking at, the reason we're here today is because we're looking at taking this model and taking it across the country to many other communities. We think this is a very scalable model. It provides opportunities for normal people, teachers, healthcare workers, frontline healthcare workers, nurses, others who used to be able to afford home ownership to be able to get back into that, to start building equity.
And so we had these two challenges of predominantly working in low-income BIPOC communities and populations, and being unable to deliver the affordable housing that we wanted to see, and being unable to have much impact on health other than being able to provide that housing. So we looked at those two problems together to see if we could find a solution that would not be a silver bullet, but could be another step toward creating more affordable housing. So we wanted to look to a source that would benefit from housing and positive health outcomes for the populations that we serve, and we landed on Medicaid MCOs, managed care organizations that we operate in the states that we operate in. So one of the key pieces for our health and housing initiative is to get concessionary capital from Medicaid MCOs or healthcare payers. And that's come in two forms so far.
At United Health Group, I mean, to your point, we have invested at this point well over $800 million in affordable housing over the last decade or so. And I think there's a few reasons for it, and I'll talk later about a couple of specific examples. But I think the very first and foremost reason why we invest in affordable housing is that housing is healthcare, right? Housing is essential to living a healthy life and being a healthy individual and a member of the community. If anyone's from kind of the health system world and wondering if you should invest in housing, the short answer is yes. And I'll happily talk to you, and I'll talk to you again and again.
What we see is that we have market failures or non-existent markets for the things we say we want and value in this world. And so it's been our job at Quantified Ventures to try to have a small role in mobilizing capital and coming up with creative financing solutions to address some of those stuck problems. And we work across the environment sector and the health and human services sectors. It is also harder, ironically, for community-based organizations to raise capital, and they work a lot harder to get the money that they do get than any other sector in the economy, and there's a slide on that later. The investment capital tends to favor investment in sort of depreciable assets, so bricks and mortar. And I'm not saying that's a bad thing. Like, I love me some affordable housing, right? But I will say that housing people is part of it. There are a lot of services that need to come alongside in order to deal with a range of issues that people are experiencing that have put them in a precarious housing situation. So whether the root cause is, I mean, actually the root cause is poverty, but right, like then you like double click and it may be substance use disorder, or it may be a work issue, and all of those different reasons have different services that you would connect. So our job is to figure out how to bring together purposeful partnerships, largely with managed care organizations and community-based organizations, so they can figure out what shared value they have, how to design a program model that delivers the impact that they want to see and the change they want to see, and that attaches a monetary value to those outcomes and allows for those community-based organizations to earn revenue consistent with the value of that outcome. A lot of managed care organizations are getting pressure from their Medicaid and state partners to have more solutions for individuals experiencing homelessness. And while we're waiting for permanent supportive housing and affordable housing to be developed, there are things that you can do now, but the cost of delivering the service is inadequately financed. And so we helped put together a deal in Detroit where health plans basically agree to pay for the outcomes that we predict they will achieve. And that ends up being the collateral for the service organization in Detroit to access the capital they needed to finish their campaign and to build out the facility. And that's the type of model that we're working on across the country.
Then what's our role as a health system trying to think about housing, and what are all the tools that we have available? We have potentially access to capital that we can bring in different ways. We can provide a lot of those services on site and think differently about them. We can engage, honestly, political capital and being able to get money for vouchers, money for new tax credits, the bond bills, things like that. So I feel like we're still at nascent stages, right? But I think for us, it has to be a business model. It can't be charity, and we know charity in perpetuity doesn't necessarily solve it. So we have to make it about a business. We actually, if you can believe it, tested this housing prescription in a pilot randomized controlled trial. We were seeing a 30% reduction in kids being in fair or poor health. We were seeing a full point difference, like a huge reduction in parental anxiety, parental depression scores. And so what that led to was now we have built out a housing prescription program at our hospital using our hospital dollars because we now see that this model can work.
One is the healthcare value proposition of investing in affordable housing, first and foremost. The second is what's the business value proposition of investing in affordable housing. And then the third is what is kind of some of the community kind of reputational and community engagement value proposition of investing in affordable housing. There's these 3 or 4 different very compelling reasons why we should continue to diversify and at the same time continue to invest in affordable housing.
And so what we did is we brought our treasurer out to the community, to one of the sites that was going to be invested in by this fund. And that's how we got to Maybe. And then we got her to the point where then she was the biggest champion. She was the one shepherding us through the finance committee and getting this commitment and getting it across the thing. And so I really just want to tenacity is really important to partnership building. So I'm just going to say that over. Don't take no for an answer. Keep trying. Get people out into the community so that they can see the stuff in action, because your finance team is your best friend. And so, but you have to be able to tap into their mission and get them out so that they can see it in action.
A partnership that's really worked well between housing and healthcare that could serve as a sort of an inspiration to others in the audience who may be looking to pursue such a partnership.
And so when you tie housing back to those social determinants of health, a homeowner's child is 4 times more likely to graduate from high school. They're 4 times less likely to become pregnant as a teenager and unwed. There are concrete things, and that's why I love what you're talking about. We can monetize those outcomes that produce real value.
I think that, knowing within your organization what appetite you have for leaning in and driving versus having the wisdom to understand who else you need to engage to do that work, I think is also really important.
We started out with the school district, and we said to the school district, how many teachers do you have that need ownership in housing? How many do you have? And they said, we have no idea. So why don't you ask? And so they asked. And they found that there was a dramatic need, and that they started asking applicants and finding out who turned down a job because they couldn't afford housing in that area. And they were, I mean, some have graduate degrees.